Well, good morning, everyone. Thanks so much. Thanks so much for taking some time to join us. My name is Dave Sebastianelli. I work for Brown & Brown. We're an independent insurance consulting firm, and we've been recently, over the last several months, working with Binghamton City Schools and helping them evaluate, trying to find the best benefits at the lowest rates for retirees. We've had the fortune of working with several districts in the local area. I'm actually from Shenango Forks. I don't want anybody to hold that necessarily against me, but we're excited to be here today to introduce this new opportunity with a Medicare Advantage plan. Part of our job to the district is to gain access to all of these insurance companies. So over the last several months, we went out to the United Healthcare, to MVP, to Blue Cross Blue Shield, to Aetna, and we were evaluating all of the benefits, making sure that we could match or enhance the current benefits offered to retirees. We worked with the different insurance companies and negotiated the rates as low as possible. And so today we actually have the opportunity to invite United Healthcare in to explain their background, their experience in Medicare Advantage, and help answer questions as we look to this new Medicare Advantage plan. One of the nice things about United Healthcare is they also work with Broome County retirees here locally, so they have some good local experience. So I'm going to introduce Joanne and David, and they're going to take over the presentation, and we're happy to be here and happy to answer any questions.
Good morning.
Good morning.
First of all, thank you for coming out on a frigid morning today. Actually, the sun is shining, and 2 weeks ago I was here driving in the blizzard, so this actually feels balmy today for me. But I do want to thank you for your participation today, and do want to give you just a little bit of background on myself. I'll let David introduce himself, and then I'll tell you a little bit high level about our organization, and then we'll get into the specific benefits. I know all of you are really anxious to hear a little bit about that. I'm Joanne Wetzel. Yes, Wetzel like pretzel. And I've been in the insurance business for 30 years and have been doing Medicare for the last several years. And I only work with Medicare, and I only work with public sector. So I work with cities, counties, school districts, and I work with a lot of customers, clients that are in this area that actually served as references for part of the due diligence that Brown & Brown was doing for the school district. But our organization has been in business for over 75 years. We've been doing Medicare specifically for 40 years, and 1 in every 3 people that have Medicare are on a United Healthcare Medicare plan. We do Medicare Advantage, we do Medicare Supplement, we do Part D, which is pharmacy, and we have almost 14 million members across the country. So we just want you to know we're not new. We've been doing this for a really long time. We're a very highly rated plan. We get rated every year by CMS, which is the Centers for Medicare and Medicaid. They rate us on how we perform. We've been at the highest levels of performance since the inception of those programs, and we'll talk a little bit about that later because that translates into what that means to you from a quality health plan that you're receiving. So we just want you to know, to kind of level set, that we've been doing this for a long time. We think when you hear about the details of the plan that you're going to go, oh, okay, this is really good. I know you've been used to one plan for a long time. You have several options in place today. When people were coming in the door, the question that I heard the most was, okay, is this a PPO? Is this Medicare Advantage? What kind of plan is this exactly? So it's kind of all of those things. It's Medicare Advantage, it's a PPO, but it's a passive PPO. So that is a very, very key point in the fact that although we have this national network, large national network, national service area, you actually can use any provider that accepts Medicare, whether they're contracted with us or not. So if you're seeing a doctor today, they accept Medicare, even if they're not on the United Healthcare list, that operates as an in-network benefit, and we'll get into some of those details more in a minute, but I just wanted to kind of set your mind at ease that this is a national passive PPO, but it is Medicare Advantage. I know it's a little bit confusing because the district offers a PPO and the district offers indemnity, and there's lots of different names and titles that fly around out there, but this is a passive PPO on a Medicare Advantage product, but because it's passive, and I'm going to repeat this because it's important, that means that you can see any provider that accepts Medicare. So if you're seeing a provider today that accepts Medicare and they're not on our list, you keep your doctor. They just file the claim with us. Your doctor doesn't lose anything. They get reimbursed the exact same reimbursement that they get today. So there's no reason for them not to file a claim with us. They don't lose anything in the process. It would just be filing a claim with a new carrier. So I hope that sets a lot of your minds at ease just as far as our background, our experience, and how long we've been doing this. One other key point that I'll mention is we have a 98% retention rate. That means that 98% of the customers that came to us have stayed with us. So I think that speaks volumes in how happy customers and retirees are with our organization. You've got to have financial stability. You've got to do customer service really well. You've got to have a positive retiree experience. You'll hear a lot from us about retiree experience. Our goal is to make it a positive experience and a very smooth transition. So those are some of the goals. You'll hear about more. I'm going to turn it over to David to introduce himself and maybe dive into the first few slides.
Thanks, Doreen. Good morning, everyone. My name is David Cinto with United Healthcare. Been with United Healthcare now for about 15 years, actually this month, 15 years. I'm always working with Medicare as well. Worked with Joanne quite a bit the past several years. So what we're going to talk about today is really the kind of meat and potatoes of how this plan would work. Okay, so Joanne went over some of the facts around it. It is a PPO plan. You can see any Medicare provider. But to jump into some of the meat and potatoes, if you will, from there. So the first thing we're going to talk about is original Medicare. Now, the majority of individuals in here most likely already have Medicare. We did have a few people earlier before we started ask, if I don't have Medicare yet, but I'm coming up on it, are you going to talk a little bit about that? So we do have a few slides just to talk about if you're coming up on Medicare. Just some things you might want to keep in mind as you come up to your birthday. Then we'll dive pretty deeply into the plan benefits, programs, and features. And then what to expect next, which really nothing yet. And then questions and answers. So we'd like to hold all our questions toward the end. So to be eligible for Medicare, you have to be 65 or older, or under 65 and eligible based upon a disability. Of course, you do have to be a legal resident or citizen of the U.S. as well to be on Medicare. Those are the basics of it there. And to go through the different parts of Medicare. So there's two parts to Medicare, and again, for those of you who are not yet on Medicare, this is where you might want to pay a bit of attention. Part A, you typically receive automatically. After you've worked 40 quarters, you become eligible for Part A when you are 65, or if you are disabled before 65. But Part B, you do have to enroll into. It is not automatic. You do have to enroll in Part B. Part B does also have a premium associated with it. About 3 months before you turn 65, you'll start to receive information from Medicare and Social Security about what you need to do to get your Part A set up, to get your Part B set up, etc. So if you're coming up on 65 and you do not yet have Medicare, keep an eye out about 3 to 4 months prior to your 65th birthday. You'll get information from the government on what your steps need to do. For the Medicare Advantage plan, should this go into effect, you will have to have Part A and Part B to be enrolled into this plan. That is a requirement of any of the Medicare plans. So just an FYI for that piece. From there, we'll talk about Medicare Advantage. So a lot of people, especially this time of year, we just left the Medicare open enrollment period. I'm sure you saw all the commercials on TV, Medicare Advantage plans, Medicare supplement plans, Part D plans. What are all of these things? So basically what Medicare Advantage plans do is they wrap all of your Medicare benefits into one plan. So instead of having, let's say, your Medicare card, your red, white, and blue card, where you have your hospital coverage, which is your Part A, your outpatient coverage, which is your Part B, and then maybe having a separate drug card, maybe then having the Blue Cross Blue Shield card, and some people might then have a supplement too. There's a whole bunch of different things you can do there. With this plan, you have your hospital, your outpatient. So by outpatient, we mean your doctor visits, your labs, physical therapy, things along those lines, and your drugs all in one plan. So you'll only have the one United Health card moving forward if we go into this plan. So you'll have your hospital, your outpatient, your drugs, and then of course additional benefits all built into this one Medicare Advantage plan. So you won't have multiple cards anymore there. All right, so again, Part C combines A and B, which is your outpatient and inpatient, includes your prescription drug coverage as well, and then we have some additional benefits that we'll touch on as we go through. All right, so to jump into the features, which is of course what everybody is really kind of itching to hear, and I know we did run out of the United Healthcare 3-page flyer. You guys came out in a lot more numbers than we expected. So we will make sure, once a decision is made, if the Medicare Advantage is chosen, we will be back to do another round of these meetings, a little more in-depth. So we'll make sure that we have additional copies that we can provide to the school district as well if they would like, that they can put on a website or distribute as they see fit. So a lot of the information, though, is available on the plan comparison that is available back on the table as well. So if you don't have the 3-page flyer, then that will assist you also for now. So to go over the national PPO. So as Joanne said, the good thing about this plan is that, yes, it is a PPO, so you have your in and out of network benefits. It's a national plan, so it does not matter where you live. If you move from New York or if you visit other parts of the country regularly, it does not matter. You can use this plan anywhere in the U.S. and its territories. You also have emergency and urgent care worldwide coverage, so if you travel outside of the country, you do have that built into the plan as well. So that's something that's included there. Prescription drug coverage is included. Referrals are not required. See a lot of people taking notes, underline not. They are not required. You do not need referrals on this plan. You can see doctors that are outside of the network as well as doctors that we have contracts with for the same copay. And we'll go through some of the benefit structure as we move through. But even if you look on the benefit documents that you have, I believe on the comparison it says full coverage. On the United Healthcare 3-pager, it says $0 in both columns as we go through these. So you'll see, well, a couple more slides before we get there. But there is no difference in your copays. And that's where you start to see a differentiation between a standard PPO versus this national or passive, as Joanne calls it, PPO. On a traditional PPO, if you go in-network, you might pay, and this is just an example, $5 or $10 to go see your primary care doctor. If you go out of network, you might pay 30 or 40% instead. That does not occur on this. It is $0 copays regardless of whether or not they have a contract. The main thing is they have to be a Medicare doctor. That's the main thing there.
David, can I add one thing? I just want to add one point. There are a whole lot of preconceived notions. When people hear the term Medicare Advantage, they assume that this is like what I'll call street plans. So a lot of you probably just spent all of October, all of November, and the first week of December being inundated with ads on the radio, on television, in your mailbox. Those are individual plans. United Healthcare sells those. We sell Medicare Supplement, Medicare Advantage, but individual plans are very, very, very different than what we're talking about today, so I just want to make sure that we dive in and kind of cover that. Street plans are what we call shelf plans, and so they're kind of predetermined benefits with a predetermined drug list, and they have some restrictions. There's different levels of benefits you can purchase for different prices, but I want to make sure that everybody in the room understands that this plan is a group-based plan, and it was a custom-built plan that was proposed to the district as part of the proposal process that David from Brown & Brown just talked about a little earlier. So we built this to make sure that the benefits were as good or better. So I think as we've got a lot of Davids today. As David goes through the benefits, you'll see that what you have today, depending on the plan that you're on, you have as good or better benefits, and then there's a lot of other enhancements that are just automatically baked in or just automatically part of our plan. They're not buy-ups. You don't pay extra for them. They're just part of our plan that we include to try to enhance the benefits, designed specifically for a retiree population. So I have people that talk to their neighbor that's on a street plan. To your example that you used earlier, they're like, oh, I've got to get a referral. Well, if they've got to get a referral, they're on a different product than this. They're probably on an HMO or a regional PPO because we sell both. This is the national passive PPO, so I just want to make sure that if you talk to someone that's on a different plan, that you don't get an idea about their plan that is not a correct assumption. So I just want to kind of drive that point home today, because there are a lot of different Medicare Advantage plans out there. This is a group-based plan that was built specifically for the district. Okay? Sorry.
And I was actually just going to say that, like, this is specific to BCSD, this plan. And there are other groups in the area that are on this type of plan, but the benefits that are included in this design are built for this group specifically. So it's not a cookie cutter plan where, oh, everyone has the same thing. We work very closely with Brown & Brown, who of course has worked with the school district, to say, okay, this is the type of plan we want. And so that's where this came from, just to add to that. Another thing too to add, I know a lot of you are getting these flyers. If you have one that at the top says United Healthcare Group Medicare Advantage Guide to Care for Healthcare Providers, I don't know if me holding it up does you any good, but that's what it says at the top. It says for healthcare providers. So basically, the one thing I always caution individuals, especially in these kind of fact-finding presentations, what is this about, how does it work? Presumably some of you, if not most of you, will go back to your doctor at some point over the next few days and say, do you take United Healthcare, right? The answer may vary, but what's important to note is that going to your doctor and saying, do you take United Healthcare? We have hundreds of plans. We have Medicare plans, we have 365 plans, we have commercial plans, just a ton of different plans. So what's important is that you let the provider know it's a United Healthcare Medicare Advantage PPO. Because if you go and you just say United Healthcare, they're going to say, oh, we don't have a contract. Is this an HMO? I don't know. We don't take it. And then you're going to think they don't take it. So this flyer is specifically for you to bring and show to your providers. When you go, it explains to them how the plan works. It explains that it's a PPO. It gives them a phone number if they have additional questions. So if you have this, please feel free to share it with your providers. We have these, we actually have quite a few of in the back there. So if you want some more, you can grab some more of these for your doctors. But that is what this flyer specifically is for. It's information for you, but it's also for you to share with your provider. So your key is going to be a United Healthcare PPO. Because once the providers hear PPO, they know, oh, we don't have to have a contract. So, okay. And they'll go from there. So I just wanted to make you aware that that was in there for you also. We do have a website, uhcretiree.com. You are able to go to that website and look up providers as well. I will just note on that website, when you do a provider search, it does bring up only those providers that we have contracts with. So if you don't find your doctor, I don't want you to get too nervous. They may be one of our out-of-network doctors that do take this. But that is somewhere that you can go just to do some preliminary research if you would like. Again, I want to reassure you that should this plan get chosen moving forward, we will be back again to do more in-depth sessions and kind of dive into this a little bit more. So I don't want you to think that we're giving you kind of half info. But that uhcretiree.com is a good place for resources on these types of plans. All right, so to get into some of the benefits, so there is no deductible on this plan. There is no out-of-pocket maximum on this plan. The reason there's no out-of-pocket maximum is because all of your copays for medical services are $0. So there's no copay, therefore there's no out-of-pocket maximum. On the deductible, one question that we oftentimes receive is, what about the Part A and the Part B deductibles? Do we have to pay those? On this plan, no, you do not. So you will not be exposed to those Part A or Part B deductibles on this plan. So starting whenever the plan would start, you would be paying the copays that we'll go over here next. There's no deductible to meet ahead of time. Right, so as Joanne was mentioning, this is where the passive comes in when Joanne uses the word passive. Whether you go in-network or out-of-network, your copays are still $0. Okay, so for your primary care physician, for your specialty visit, urgent care, emergency room, inpatient hospitalization, outpatient surgery, still $0. One question we often get is, well, what happens if I go to the ER, they don't really admit me, I'm just kind of in observation, but I'm there for a couple of days, that happens sometimes. Where does that fall? That's your outpatient observation, still $0. So either way, you are covered under that $0 copay. So again, these are just kind of the big hitters, the questions we get most often. There's of course a whole whole list of additional benefits that are covered. For preventive services, so annual physicals are included, annual wellness visits are included. Sometimes we get the question, what's the difference between the two? Your wellness visit is really more of a consultation with your doctor. How are things? Anything new going on? Having any problem with your medications? Things like that. Whereas your physical is the actual hands-on pulse, reflexes, listen to your breathing, etc. Immunizations are covered, flu shot, shingles vaccine, etc. I'll just add a caveat. The shingles vaccine is covered, but it's covered under the Tier 2 drug benefit. Medicare processes that as an outpatient drug, not an immunization. So it is covered, but there will be a copay for the shingles vaccine. Breast cancer screening, colon cancer screening, all included as well. Additionally, not only do you have access to the preventive services, but we do have a program called United Healthcare Rewards. And with that, every time you get a preventive service done, whether it's your physical, breast cancer screening, colon cancer screening, your flu shot, you are eligible for a gift card incentive. So you would call customer service, hey, I did this, is there a reward available for it? They'll tell you yes. There's a whole host of different vendors, whether it's Walmart, Target, Starbucks, Amazon, Whole Foods, etc., that you could get that card for. So just an FYI there is a little bit of an incentive built in to do that. Of course, why do we do that? We want to incentivize people to get their preventive care, ultimately to catch things early, right? The earlier the better. So there's a few different reasons behind that. All right, to go through some additional, so Medicare covered podiatry, chiropractic care, vision services, and hearing services, all $0. You do also have included a vision exam and a hearing exam, which are separate from these Medicare-covered vision services. When we talk about Medicare-covered vision services, what we mean specifically is any medical conditions of your eye. So if you have macular degeneration, glaucoma, pink eye, whatever it may be, that you have to go see your eye doctor, monthly or however often, that is fine. But you do also have an annual vision exam just to test your vision. Same thing with the hearing. You have a hearing exam included annually as well. But if you have any medical conditions of your ear, you can of course go to those doctors as often as you would like. Right, so to jump into some of the drugs again, you can do pharmacy and prescription searches on uhcretiree.com if you would like. So to get into, who's heard of the coverage gap? Anybody heard of the coverage gap or the donut hole? Few people, okay. So without trying to confuse anyone, including myself, too early in the morning, basically how it starts is January 1st, everyone receives a bucket of money of $4,020. Okay, every time you go to the pharmacy, whether your prescription is $10 or $100, they deduct that from your bucket of money, that $4,020. Once you have used this $4,020, you would normally, and I say normally because you're not on a normal plan, you would normally move into what they call the coverage gap, which is where you would have to pay 25% of the cost of your medication. All right? This plan does not have the donut hole. It does not have the coverage gap. So you will continue to pay your normal copays. The reason that I stress that is because if you talk to your family about this, or if you talk to your friends about this, you have friends that are on maybe a street plan like Joanne mentioned earlier, they probably do have a donut hole. Or someone may say, do you have the donut hole? Do you have a coverage gap? The answer is no, and I want you to be very sure of that answer. You do not have the donut hole, because that can stress people out very easily if they think suddenly they're going to have to pay a significant amount more. So you do not have a donut hole on this plan. Do you want to add anything?
I will add, we added an additional, remember how I talked about earlier, this is not a street plan, this is a proposal that we built specifically for the district. So we added what we call a custom catastrophic benefit to the coverage. And what that means is a lot of folks, especially if you're taking a really high dollar drug, in the world of CMS and their standard rules, if you were to spend $6,350 in drugs, you would have to pay, they give you some options. It would be $3 something for generics, $8 something for all others, or 5%, whichever's greater. Well, 5% doesn't sound like a lot, but if you're taking a drug that costs $20,000, 5% is a big chunk of change. So Not many people hit the catastrophic phase, especially if you're taking generics or preferred brands. But keep in mind, CMS calculates this by the total spend. So it's not just your copays, it's the manufactured discounted price. So if you're taking a really high dollar drug, you could get into the catastrophic phase within a few months. So we built an additional custom benefit on top of already rich benefit design that says if you do take a high dollar drug, you're going to be okay. Because what's going to happen when you hit that catastrophic phase is you will never pay more than what you were already paying all year long. A lot of you already know this, that CMS resets those phases every year. They're not set by United or any carrier. CMS each year says what will be the what takes you into the donut hole or the gap and what takes you into catastrophic. This protects you if you want to take that high dollar drug from not hitting that or 5%, which is the scary part of the catastrophic phase. So that's just one more thing that you should feel good about with the plan that the district was asking us to propose as a part of this. So very key for folks to know.
So good. So that's a perfect segue into the copays for your medications. So these copays here, the $3 for your generics, $5 for preferred brands, $20 for non-preferred brands, and then $20 for your specialty, those will be what you pay throughout the entire year. There will be no change in your copay responsibility. So again, if you have someone ask, well, what about when you hit the coverage gap? You don't have a coverage gap. As Joanne just said, even your catastrophic coverage. And again, these are levels that you may not even know that you're in. These are things that we track on the back end for reporting to Medicare, and Medicare tracks a lot of this. So the key is you are $3, $5, $20. Those are your copays throughout the entire year. We had a question earlier before we got started. Do we have to use mail order? No, you do not have to use mail order. You can still receive 90-day supplies at your local pharmacy if you would like. You don't have to get a 90-day supply if you don't want to, but if that's something that you're used to doing, then you do not need to. We do have a mail order company, if that interests you, called OptumRx. It's a United Healthcare owned company. If you do want to get mail order, that's available as well, and the copays are the same for the 90-day supply. Yes, ma'am. Correct. For the
This one was actually custom too. We actually built this in where it stays the same, so it's matching what you would have if you're on the indemnity plan today. So you have just one copay. So that was something that we customized. So that's different than what the industry standard or even our standard. So you have the option with the plan that Brown & Brown requested and worked with the district to build, and the fact that your copay stays the same, whether or not you get the 30 or the 90, or you do retail or mail order. So you have kind of the ultimate in flexibility, which is nice. There's a lot of people that would love to have this pharmacy plan.
yeah, and that is actually a very uncommon benefit that we don't often see. So again, so kind of recap that, but the question was, I see you have $3 for a 30-day supply at your retail pharmacy. What if I get a 90-day supply at my retail pharmacy? It's still $3. And the same would be true for the other levels as well.
Keep in mind that your provider does have to write the script that way.
Right.
So they have to release it as a 30-day or a 90-day supply. So if you want a 90-day supply, make sure that you address that with your provider so that you don't go to the pharmacy with your 30-day script and want a 90-day script. It's a pretty easy change, but it'll just save you a step if you ask for that up front. There are some drugs, high-risk medications, or other specialty drugs where they will only allow 30 days. For any maintenance drugs or anything that you're taking now that you're getting a 90-day supply, you should continue to have the same thing. It's rare that you can't get a 90-day supply unless it's something that they really need to monitor you on, or maybe it's something that's administered in the physician's office.
All right. So to go from there, so some additional benefits that are built into the plan. We do have a diabetes testing and monitoring supply benefit that is built in. So if you are currently testing your blood sugar, the One Touch and Accu-Check blood glucose testing strips and meters are available for $0 copays. That does include the lancets, the device, the glucose control solution, as well as replacement batteries. Some individuals say, well, what if right now I use a different brand? You just have to get a new prescription from your doctor for one of the One Touch or AccuCheck. You take it to the pharmacy, they process it through the insurance, and then you'll have the $0 copay for any of those items there. Yeah. That falls under a different benefit altogether, so that's not part of this. This is just for the testing, like just the testing itself. Like if you prick your finger, you have the. Oh, it goes with the pump at the same time. I'll have to check into that one. I'm not sure if that kind of fits into this or not, but I'll double check on that. Yeah. Oh, I'm sorry. The question specifically was, what if you have an insulin pump that goes along with the monitor or the meter, right? Yeah. So in that case, I just have to double check because I know this is typically for just the meters where you have the strip, and I'm not sure if you pair it with the insulin pump. We'll have to check on that. All right. So different ways you can save on prescriptions, of course. If this plan goes into effect, review your medications. Always use your ID card. It's very difficult to find pharmacies that don't work with the larger insurers nowadays. United Healthcare, Cigna, Blue Cross, etc. So if you have questions on specific pharmacies, you can see us afterwards, or you can go to that uhcretiree.com to take a look there. A lot of doctors will offer trial supplies. That's up to you and your doctor if you want to take advantage of those. United Healthcare house calls. This is a benefit where basically, if you come onto the plan, we will call you a couple months afterwards to schedule a nurse practitioner who works for United Healthcare to come do a house call where they make an appointment, come to your house, sit down, ask you questions, review any medical conditions you may have. This is a voluntary program. We will call you to try to schedule it, but it is a voluntary program. You're not required to make the appointment. Some benefits that come from this: United Healthcare has a host of clinical programs, whether it's related to Alzheimer's, diabetes, cancer, heart conditions, anything like that. We're in these conversations with the nurse practitioner. They can refer you to our programs internally, and then we can work with your doctor to say, okay, we understand there are these conditions that exist. Is there anything additional that we need to have at the ready, considering these different conditions? So there's a lot that can come of this. They can talk to you about nutritional issues if you have questions on diabetes, etc. I used an example that happened a couple years ago. We had an individual in southern Louisiana who had a house call, and the nurse practitioner came, and the individual was in a walker, and there's no big deal about being in a walker, but when she went inside with this individual, she noticed that her house was full of stairs. Okay, so if you're a nurse practitioner coming in to do kind of a health assessment and you see a walker with a whole bunch of stairs, what are you thinking of from the beginning? What's the risk? You're gonna fall, right? So if you're a nurse, okay, you're going to fall, and then, gosh, now we have an inpatient stay, an ambulance ride, maybe physical therapy, maybe a hip replacement, a whole host of things that could come from this. So what they were able to do was refer her internally with some United Healthcare programs. We also work with some community organizations to have ramps installed throughout the home to help mitigate that risk. But we would never have known that this was the case if we didn't have a house call, right? So there's a lot of different things that can come from these programs. We're not just coming in to try to ask you a bunch of health questions. There are a lot of community programs that we work with and internal programs that we have as well that can assist you in ways that you may not have imagined that we would. So just keep that in mind. If you come onto this plan, you will get a call to schedule this. It is up to you. You don't have to, but we certainly encourage you to. Oh, got a battery.
I just want to pile on this house calls program. So a lot of people are like, so you want somebody to come in my house? And that makes some people nervous, and we can certainly understand that. I want to stress this, David said it earlier, but I want to stress again, 100% of the people that do our house calls are W-2 employees of United Healthcare. We take this very, very seriously. We don't contract this out. We don't lease it out. We don't have this patchwork quilt of folks across the country that do this. We also know that healthcare is local. Getting healthcare in Binghamton or Vestal or Syracuse is very different than getting healthcare in Miami or New York City or California. So we hire these clinicians. We hire over 2,000 people across the country just to do this service because we don't want to farm it out. We hold everybody to the same standard. It's part of how we get judged by CMS and how we perform. And once people go through a house call, even if they were a little nervous, had a little trepidation, once they have one, they love it, and they can't wait to get their next one. And it's also one of those things where you actually get a reward for it. You know, when David talked about getting those gift cards in the mail earlier, you know, we give gift cards for doing just healthy behavior and things you want to be doing anyway. If you do a house call, you get rewards for that. But we also take some other steps, like we'll call you a couple of days before the appointment and say, hi, my name is Jane Doe or Sally Sue. I'm going to be the United Healthcare clinician coming to your home. I'm going to have on a red shirt. I'm going to have my name badge on. I'm going to be driving XYZ car. So you know that when that person pulls up to your house, that they're supposed to be there. They also do a comprehensive review of your medications. There's been many times where we've had clinicians go into the home and someone could be taking expired medications. Somebody could be taking 10 medications and we can get it down to 5 because we've learned about other conditions or a medication that can take care of multiple conditions to try to cut down on taking multiple prescriptions if you don't need to. So could increase your quality of care and also help you with out-of-pocket expense as well. So this program is very, very popular, and it goes a long way in determining quality of care outside of the provider. But I also want to point out that this doesn't take the place of your primary care physician. We consider this an extension of your primary care physician. So we're sharing those results with your primary care physician. You get those results as well. We take those results and try to promote programs that we have that are available that can help you have better quality of care. They are voluntary, they're not mandatory, but they're there for you if you choose to take advantage of them, should you have some of those chronic conditions where those programs match up with that.
We'll just share. All right, perfect. So we mentioned United Healthcare Renew earlier. That is the program that includes the incentive reward that Joanne just mentioned, that I also mentioned earlier with some of the preventive care. Additionally, when you get your ID card, if you were to come onto this plan, you get your new ID card from us, you can register on our uhcretiree.com website. You actually have access to the Renew magazine, which is really a digital publication that has information on healthcare conditions. It has recipes, it has tips, it has new topics, all kinds of FAQs in there that deal with any, particularly of the Medicare population questions that may come up. On the website also, there's games, there's music you can listen to, there's recipes, there's information on diabetes, etc. There's a whole host of information available within this program. So it's not only the magazine, it's not only the rewards program, it's also just a lot of additional topics that you may find beneficial. So again, should you come onto this plan when you get your ID card, that's something that's available on the UHC Retiree website also. Silver Sneakers, who's heard of it? Good, a whole bunch of you. Good. Do you have it today with your current plan? No? No? Okay, good. Well, that's even better that so many of you have heard of it. So good. So Silver Sneakers is included in this plan. So for those of you that are not familiar with Silver Sneakers is basically a gym membership that is included within this plan. So if you go to silversneakers.com, you can put in your zip code. It'll give you, depending on the radius that you choose, all the gyms in the area that work with Silver Sneakers. They verify based on your ID card. So if you were to go with this plan, you get your new ID card, then they would just verify it and you no longer have to pay a monthly membership at that gym. So if you're currently paying for a membership, you would no longer need to, should you move on to this plan. So again, there's a lot of different facilities in the area that take this. Of course, I know not everyone lives in Binghamton itself, but there may be additional gyms in your area. So feel free to visit that website if you would like. I can't name a couple offhand. I know we have Anytime Fitness is one that takes it pretty often. A lot of the Ys take it. Planet, the local Ys take it. It really depends on those facilities. Not every 24-hour fitness is going to take it. Some do, some don't. Not every Y takes it, but a lot of them do. So there's a pretty extensive list. But if you have some you'd like to check specifically, you can see us afterwards. But again, the website is silversneakers.com if you want to take a look at leisure. not assigned a specific one. Right.
Which
Yep.
is a really nice benefit.
Yeah, and that works as well if you're traveling. So if you're traveling nationally, let's say you're in New York and next week you're going to be in Georgia, the next week you're going to be in Florida, you can use them around the country. You don't have to have one gym and always have to go to that one. You can use different ones locally. You can even use them nationally as well. So it's a good benefit that moves with you. Does it pay a percentage of the whole amount? So the agreement with Silver Sneakers is we pay them a certain amount per month and you don't pay them at all. Right, for the membership.
No cost period.
For the membership, right? Now, if there's some super duper fun yoga class / cycling or whatever, you might have to pay extra for that, but for the basic gym membership, yes, that is covered. Yep. Okay. Virtual visits. So this is, who has a smartphone or a tablet? Just to show, all right, good. Sometimes I get like one person and I'm like, oh, okay, never mind. We should maybe skip this slide then. So virtual visits is basically, there are two applications that we use. One is called Doctor on Demand, and one is called AllMed. Yeah. No, Amwell. Sorry. AllMed. Where'd that come from? Amwell. Sorry. But basically, you can download either of these onto your phone or onto your tablet from your respective Play Store, whether it's a Apple or whether it's a Samsung or whatever else you may have. You put in your ID number, and it will allow you to video chat with a doctor or a healthcare or a mental health care professional, depending on what your need is at that time. I have used it in the past where I've woken up and I felt like I got hit by a truck. My doctor can see me in 3 days, but I'm that guy where I'm going to be dead by the end of today, so I need to see someone today, right? So I've gone on, sometimes you can pick a doctor if you see one on there that you're familiar with. Sometimes they're local doctors, but these are national providers as well. You log on, tell them what's going on. In my case, I had strep. It was a little awkward to show them your throat, but they were able to figure it out. They sent a local prescription to my local grocery, or sent a prescription to my local grocery store. I didn't have to go to the doctor. I just was able to use this. So if you find yourself in a situation where you need to see a medical professional and you're unable to go to your normal doctor right now for some reason, this is a good alternative. I've used it. I love it. I know some people are like, I don't like that idea. You don't have to use it, but it is available if you want to. Additionally, we do have behavioral health visits available as well through the same programs. So if you want to take advantage of that, those are also available. There are no co-pays for these as well, so you don't have to worry about any additional expense. Nurse Line, 24/7 access to nurses just to ask general questions, whether it's on an upcoming procedure, you want to know kind of what that recovery is going to look like. You have questions on, whether or not medications will interfere with each other. Any medical questions whatsoever that you may have, you can call. They're 24/7, 365. So you have that available also. United Healthcare Hearing. So there's a $500 hearing aid allowance every 3 years built into this plan as well. So United Healthcare Hearing, it's hence the name, a United Healthcare company. We offer hearing aids that start around $699 per ear. If you've been on the market lately for a hearing aid, they can range anywhere from $2,000 to $4,000 depending on the model you're looking at. So these are just discount hearing aids. It's a United Healthcare company. We can control the cost on those. So if you're looking for hearing aids, you are able to use that $500 allowance in conjunction with those discounts. So your out-of-pocket for your hearing aids can be significantly lower. There are United Healthcare hearing providers that you can use. If there's not one locally, you're able to go to any audiologist that takes Medicare, get the prescription, mail it into United Healthcare Hearing. They will mail you your hearing aid. If you need fitting adjustments, they work on those as well. Oh, right, yep. So you still have that in and out of network, yep. So just wanted to add that is in there as well. So again, $500 every 3 years. And that kind of rounds it out. So is there anything you'd like to add before we open it up to? No? All right, so we'll take a few questions to start out. Yes, ma'am, in the back, and then we'll come over here. So the question was, the impression was that this was a done deal, that we are moving to this. Is that the case? And I will let the district speak to that, or...
This is an expedited review because Brown & Brown were very aggressive in taking what the district's needs were, which was to provide more affordable care to you, And so Brown & Brown did put it in a fairly aggressive timeline. So our opportunity is to have this today. We are going to have to make a decision fairly quickly. It would not go into effect until April 1st. So there'll be multiple opportunities to have follow-up meetings with United Healthcare. But after today, we are going to have to make a decision. But it has not been made yet.
Hi, I'm Lynn Munson-Hunkovic. I am one of the co-presidents of the Eastern Boone Branch Retired Teachers, and when I found out about this situation last week, Monday, I have been in contact with Nisterton NYSERD Southern Zone present and past Binghamton Teachers Association presidents, trying to get all the information possible so that we could know what is happening. I have a question for Carrie. Please correct me if I'm wrong. People who are currently employed as teachers in the Binghamton City School District will have a one-time option to go back to Blue Cross Blue Shield if they are dissatisfied with UHC as our secondary insurance. Is that correct?
Not exact. You have to be more specific. So
if current teachers are dissatisfied with UHC coverage, after 1 year, I have heard that they would have the option, a one-time option, to change back to Blue Cross Blue Shield Excellus. Is that correct?
No, that was actives. You would have to be 65 as an active employee to be moved to United Healthcare. So I'm confused by the question. Are you saying for after? If I'm active
What I'm
today,
saying is that I heard that
yes.
current Binghamton City School District employees, if they are dissatisfied with UHC insurance, if they vote to accept it, they would have an option after 1 year to go back to Excellus Blue Cross Blue Shield. Is that correct?
That is not correct.
All right, thank you.
This forum was really educational, informational. Like I mentioned, if we are chosen to move forward come 4/1, we will be back. You probably won't see Joanne back again, but it'll be myself. I am the account manager with United Healthcare, so I'll work very closely with Brown & Brown as well as the school district on any questions that do come up. When we come back, we will have additional individuals such as myself. We will have kind of the formalized booklets with phone numbers for how to get in touch with United Healthcare with questions. And then we will remain as well. So I'm not going anywhere. If this happens, I will be the face with United Healthcare to come to with any questions. So I just wanted to make sure everyone understands this isn't the end of us being here if we come. And yes, we're not. I might live in Florida, but we have a lot of other clients in the area, especially in Binghamton. Premiums, I will let someone else speak to, and that's not my department.
While we're passing the mic to someone that can do the district question, I want to pile on as far as contact. So we take great pride in the fact that we assign a full team to every customer. That's part of the reason why we have a 98% retention rate. So in addition to David, who is the strategic account executive, should this move forward for a 4/1 effective day, you would have a client service manager, a service account management team. I mean, you have an entire dedicated team, an implementation manager. So those are contacts for the district. We also, I mean, your cards are going to have phone numbers. The booklets that you receive in the mail are going to have phone numbers. We would come back again with phone numbers in another presentation, and believe it or not, the additional presentation is even longer than what you heard today, but it really gets into a lot of detail should the district move forward, and even more benefits. Who are your contacts? Where do you call? How do you enroll? All of those sorts of questions. We kept it high level today so that you would know what the plan is all about and what it's not about, because people a lot of times will have preconceived notions unless they hear that this is a group-based plan. So just wanted to make sure that we take great pride in customer service, and that's part of the reason why we have such a high star rating by CMS. And so you're not going to be left high and dry. There'll be plenty of dedicated contacts depending on what type of question is coming our way.
Assuming the plan goes into effect April 1st, when is the plan next revisited as far as any changes to the plan? How long is that in effect?
It's going to go to a 1/1 January 1st review cycle. And
The question was, when would this renew? If it came on board for a 4/1 effective date, it would renew for 1/1, and there's a reason for that. CMS, Centers for Medicare and Medicaid, reset everything on January 1. CMS also establishes their funding on what we call a calendar year basis. So it's to your advantage and the district's advantage to be on a 1/1 cycle to match up with that calendar year. So to answer your question, it would go 4/1 through 12/31 of this year and would renew 1/1. Did that answer the question?
Yeah, so the second part is what kind of changes might you expect to see? Is that right? Okay, good. So that's exactly what I. So the one thing to keep in mind is that this plan design is owned by Binghamton Central School District, right? Or city school district. So this is their plan design. So right now it's $0 plans. We certainly would not change. The only thing that we would change is some of the CMS mandated changes, and that's really on the drug, which is exempt from anyway because you have a custom plan for that. So would there come a point in the future where maybe they say, hey, what if we raise a copay to $5 or something like that? It could happen. Those would be driven by conversations within the district. They are not United driven. We would work with Brown & Brown on the renewal, on the rates. A lot of things go on with the rates in terms of what is CMS funding, what does the Medicare reimbursement look like, et cetera. So all of that is looked at every summer.
So I'm going to maybe get into the weeds a little bit more than you want, but I think this is important. So how we are funded as an organization on Medicare products is dictated by how we perform. So we are a 4.5 star rated plan, and we have been a 4 or 4.5 star rated plan since the inception of CMS rating plans. That's important for you to know because it drives how we get paid, and when you're a high performing plan, you get paid higher than other plans that don't perform highly. Because a lot of people, when they see these plans, are like, well, this sounds too good to be true. I'm getting better benefits at a lower cost. Well, when you get paid higher from CMS, that translates into lower premiums, which translates into lower cost for you. It also allows us to add other benefits that are baked into our plan. So we actually get judged by CMS on 43 different measures: quality of care, customer service, hospital readmissions, how we're handling chronic conditions. There's a whole host, there's 43 measures. So in addition to being highly rated on all of those measures, we also track risk through house calls by identifying risk. And when you identify risk and report risk to CMS, that also drives how you're reimbursed through CMS. I'm telling you all of this because what that means in the end is it gives you financial stability, gives you premium stability, which also allows us to have renewals that are in single digits or either flat renewals. Our trend over the last 8 years has been anywhere from 2 to 7% for our renewals on a Medicare product, which is very, very low. We've even had some rate passes and even some rate reductions. So we've performed very, very well from a financial perspective. As part of that 98% retention rate that we have. We could be doing everything extremely well, provide the best customer service, but if we don't keep our rates in line, we have customers that could say, we love you, but we can't afford to keep you. So we believe in, you've got to have great customer service and quality of care, but you've got to do it at a financially stable rate. So that's a really long answer to your question, but I think it's important to know some of that background because Medicare is very different from a commercial plan. So commercial plans are all about negotiating with providers and getting discounts down, and that doesn't enter our world. In our world, it's more about CMS funding and how we perform as a carrier.
So in other words, what you're saying is that our monthly payment from year to year will depend on how much the services in the past, doctors, hospital, etc., have been used. So if you're
Not used. Doesn't have. No, we encourage utilization. It has to do with how we're performing, has to do with CMS funding. It also has to do with whether or not the district decides to make changes to the plan design as well. Has nothing really to do with utilization. I mean, I could do an underwriting class here today, which would make everybody want to run for the hills. But unless we have some actuaries in the room, they would love it. But from a utilization perspective, your group isn't large enough to be fully credible. So what that means is, we could take all of your experience, but unless you get up close to 1,000 lives, that experience has very little to do with how we would rate your renewal. And it has more to do with CMS funding and how we're performing.
I have a question about under observation. I have a lot of experience with that because of my late husband's illness. When you go into a hospital, and correct me if I'm wrong because this is going back 5 years and things may have changed. When you go into a hospital, it is possible for you to be admitted as under observation rather than as an inpatient. And if you are admitted as under observation, that means that you are responsible for some of the health costs which you would not be if you were admitted as an inpatient. And it is possible too that you could be admitted as an inpatient and then the hospital could switch you to under observation, because the latest rules are that you have to stay 2 nights and 3 days to qualify as being an inpatient. Is that the same, or has that been changed, or how would our costs be affected if someone tries to do that, if you or a loved one were to be admitted?
So that is still the definition, yes, and as I mentioned in the presentation, that would still be $0, because outpatient observation is $0 under the benefit. So it would still be the 0.
In other words, it's still what it was in the past, because in the past, as I said, people would have to end up paying bills they
Well,
would.
the definition is what you said, but your copay, the way that Medicare pays for that on these plans, would have a $0 copay.
In
So
other
you would
words,
not have
you
it.
would not have to pay anything if someone
Correct.
were to put you in as under observation.
That's correct.
All right, that is a change.
Along the same lines, what about pre-authorization?
Pre-authorizations.
Of whatever.
So pre-authorizations, if we have providers that we have contracts with, so what we call in-network providers, we have agreements with them on prior authorization. And they're aware of what those are, so if you have an MRI, you might need a prior authorization for that to make sure it's for the right thing. If you're going to an out-of-network provider, someone we don't have a contract with, they do not have authorization requirements. So there would be no need for them to go through those
Are there any
authorization
penalties
steps.
if you don't get pre-authorization?
Are there any penalties if you don't get them? I mean, if you are supposed to get an authorization for a service from an in-network provider and you don't, there's a chance that claim could be denied because they didn't get it, but that wouldn't be your responsibility to pay in that instance.
So we as an organization sell individual plans. We have a whole product line called AARP Med Sub and AARP PDP. Those plans are filed every year. They're filed by state. Every state in the union has the exact same benefit except for 3 states, Massachusetts, Wisconsin, and Minnesota or Michigan. Anyway, 3 states that have a little bit different benefit. Those benefits are shelf benefits, and you refile those benefits every year. It's important to note, this is a group plan. This is a federal approval, not a state approval. And we file benefits in benefit groupings. That's why we can take this plan and customize it. Like we can say, if Brown & Brown came to us and said the district wants to have a $5 copay here, and they want to have a $100 deductible here, and they want to do 0 here, we can do that because it's a group plan. The district gets to drive the eligibility. We also get to pick from different formularies, drug list. With this particular plan, we picked the most robust drug list. We added a bonus drug list. We added the custom catastrophic benefit. So what you described is correct, but not in this scenario. So your plan gets renegotiated every year, but the district drives it, not how we file with the state or the federal government.
So I've been on the PPO through the district. Finances are always a concern for all of us because our incomes do not go up. So you have here a monthly rate. And now you're saying that we're going to take that monthly rate. Now in my case, it's my husband and I on plan. So you're saying, if I understand you correctly, and I would like confirmation, you're going to deduct from the $581.26, $144.60, and another $144.60. Is that correct? For my husband and for me, who both are on Medicare, and we both pay out of our Social Security, each of us $144.60. So you're gonna take the two of our deductions off the 581, is that correct?
Yes, that is correct.
Thank you. Why hasn't that been done for my current PPO? I don't get a deduction.
You do get the deduction for the Medicare.
No, I
The
do not.
difference is the rate. So
Right.
because the two of you are on the current plan, you get the family rate. Now we're breaking it and basically you're getting two individuals. And that's a significant difference than if you're on classic indemnity now
So
or the PPO.
it's going to be 288, 289.20 from the 581.
Correct.
Okay. The next question was,
Is the whole district going on this, or is this just for retirees? Like, if they vote on this,
This is
no longer Blue Cross Blue Shield, it'll be United Healthcare?
Blue Cross Blue Shield is for active employees.
We're self-insured for active employees, so Blue Cross Blue Shield just does the administration. That's it. So we really don't have Blue Cross Blue Shield coverage for active.
Well,
So we are moving, Blue Cross Blue Shield is our administrator, but we do everything based on experience. So United Healthcare is just going to be the administrator of the Blue Cross Blue Shield, of the Medicare Advantage plan. But it's through them entirely.
okay, so I'm 62. This will be a few more years, but my husband's over 65. So am I still covered under whatever plan we have through the district?
Yes,
For
you'll-
active teachers?
Yes, you'll have to maintain an individual coverage for yourself under Blue Cross Blue Shield, and your husband would be able to get the
Oh,
single.
so instead of the family plan, I'll go down to the individual plan? And
Yes.
then have the
Yes,
United Healthcare
until-
for you?
Who are not yet age 65 will still be covered by Blue Cross Blue Shield totally until they start Medicare.
They're required by the district because we're self-insured.
Yes.
So if this goes through, Cindy's going to take care of all the paperwork and get
Yeah,
us on.
so
the right
Cindy
page.
is sitting in the back, Cindy O'Shea is sitting in the back, and next to her is Camille O'Brien, who you might have worked with over the years as well. They're both here, so they're listening to the same information that you're listening to, and will be able to answer individual questions as well as future meetings that we'll be holding. But given all that we have learned, we have listened critically prior to us coming today, numerous times with Brown & Brown for us to have an assurance that is equal or better, that there is no pitfall that we could see, then we would move forward because it's a win-win for you members. It's a significant savings, at least $100 a month cheaper for an individual. It's significantly more than that if you currently have family coverage. And we know that that has been a initiative that was started many years ago. I've been in central office almost 10 years, and we have continued to look at that. And I have to say, on behalf of Dr. Thompson, she was very aggressive when she went out. We had a different consultant group out of Syracuse, BPAS. She had gone to a couple of presentations from Brown & Brown where they were helping other districts. She brought Brown & Brown in. They were very aggressive in searching out the best plan. They knew it had to be equal or better, and so they continually came back. We checked, we verified, and they went back out and looked at the rates and got us what we believe to be great rates for the coverage. I've had at least 3 questions regarding if you had to move off of our family plan because it was too expensive and went to a single, can you move back on now that we have this opportunity? We will get that answer for you today, and we will post it. Actually, if you're interested in that, I hate to bombard Camille and Cindy, but please give your contact information, and then I will make sure that I reach out to you by this afternoon. This came very fast. As I mentioned earlier, we got the information. Brown & Brown just came on board. It takes time. We then had to evaluate to make sure that we did have the same level of benefits. And then it came to our attention that this was based on a 4-1 enrollment. So we had to really go quickly, which is why you only had a week notice. Originally, we thought it was July 1. So again, there's a learning curve for us in central office. This is something that we had not entertained before. We understand that it wasn't the best way to roll it out, and we do apologize. I will say on behalf of central office, and now other than Tanya being the most senior person there, Eric is brand new, so he takes no fault. Please email me directly if you have a question. I will either answer it or I will make sure somebody answers it within 2 days. And if I'm not there, I will make sure that I'm out of the office so that you would know that why it's not being returned. My email address is Mullins, which is MULLINSK @binghamtonschools.org. And my phone number is, and this is a direct line to my office, is 607-762-6056. Thank you. Thank you for your time today. We appreciate it.